Part of the Hygiene and Care Starter Kit, B500, we supply a CFU testing kit. This comprises of a dip slide, and this has to be done on older units or a unit that has been supplied and you're about to shock the system. What you need to do is take out the dip slide, take out the 3-in-1 syringe, remove the tip, and over a sink just run for 10 seconds onto the dip slide. Once you've done that, replace your syringe, pop the dip slide back into its case, and that is now ready for incubation. Once you have your dip slide, incubate at 30 to 35 degrees C for 48 hours or 72 hours at room temperature. Once this period of time has gone, compare incubated slides to the chart provided. If CFU count is low, dental unit is ready for use. If CFU count is high, unit requires shock treatment. Once you've incubated your dip slide and the CFU count is high, you must shock the unit.